Every revolution starts in the minds of the people. Arm yourself for the war of ideas. Take back your life. Take back your liberty. Tom Mullen Talks Freedom.
Hello, everybody, and welcome back to Tom Mullen Talks Freedom. Today, my guest is Gary Dickson. He's the town supervisor of West Seneca, New York. That is an Erie County suburb of Buffalo, New York. He is the first Republican to be elected town supervisor of West Seneca in 50 years, back in 2019. So he was elected just in time to take over for 2020. Lucky him. And as of 2021, he has the first Republican majority town board in West Seneca. So things are changing in West Seneca, and we've got lots to talk about with him today. Gary, welcome to the show.
Thank you very much.
Now, last week, the Erie County executive, Mark Poloncarz, instituted a mask mandate based on the number of cases or hospitalizations in Erie County. And you've made a little news for yourself over there by saying that West Seneca is not going to comply with the mask mandate. What does it mean for the town to not comply, and what does it not mean?
Well, I didn't say we would not comply. I said I strenuously objected to it for a number of reasons, but I did not say, and you know, sometimes people hear what they want to hear. You know, usually I've done a few TV interviews, and I always start with, you know, I am not anti-vaccine. I am not necessarily anti-mask. I've had my booster shot. I've vaccinated. If a business asks me to wear a mask when I come in, I'm perfectly happy to comply. But so, and then, you know, every title's got to be clickbait. So, you know, they put in, you know, will not comply, and it's not true. I mean, I'm a retired FBI agent. You know, I believe in the law, and even if I don't like the law, I still follow it. And you know, these mandates are apparently legal. No court has challenged them, so therefore, you know, we have to we're complying in town buildings, which is really all I control. So,
is it expected that you will order the town police to enforce this, and will you do that, or is this something that's only enforced by the county sheriff? How does it work?
No, you know, the West Seneca Police Department has plenty of things to do already. They have all their jobs that they're normally doing, and they really don't have the capacity to go around being the mask police. But you know, this is a county mandate. Certainly, the county has the right, the health department, to do their inspections. I haven't heard of that they're doing anything. I have been in some of the larger stores where most people are wearing a mask, but there are people that are not. I think, you know, people are being giving people a little more leeway than they did in the beginning.
Well, and we are in a different situation than we were in March or April of 2020. We didn't know very much. So isn't a different response called for?
Yeah. So what caused me to object was when he made, as you said, he made the announcement that because of pending, you know, 100% capacity in the hospitals, he was instituting the mask mandate. And if that doesn't work, he's going to institute a vaccine mandate. And if that doesn't work, he's going to institute capacity restrictions. And if that doesn't work, it's lockdown. You know, so we're back to March and April of 2020. So, you know, just simply as a curious citizen, you know, when he said hospitals are near capacity, I thought, well, geez, I wonder what is the capacity of hospitals in Erie County. So it turns out the health Department of Health and Human Services has been collecting data from every hospital in the United States since at least the middle of 2020. That is on a database that anybody can download and look at. And so I downloaded it and I looked at it for Erie County, and I was very surprised to see that as recently as July, there were 300 more beds in Erie County, about 2,300 inpatient beds. And now there's 2,000. That's over 10% in 4 months. So I thought, well, geez, obviously, if the number of available beds goes down, then that's just going to exacerbate the capacity problem. And it's true. If we still had those beds, we would not have the hospitals would not be stressed like they are right now. We would be pretty much like we were 6 months ago. I mean, the hospitals would be getting by. So as someone who is in public life, and I mean, I have a master's degree in public policy, our government is supposed to plan for this stuff and prepare for this stuff. And he's got, he has a whole department full of epidemiologists and he's got a health commissioner and all that stuff. So why did the capacity go down? What could they have done about it? But the bigger question is, what are they going to do to fix it? Because I personally don't think COVID's going away. We've got waning vaccine effectiveness. I mean, the J&J vaccine is almost worthless after 6 months. And then we've got variants. So I think we're going to continue to have spikes. So it behooves government to prepare for that. And if the state and the county have hundreds of millions of dollars that they got from the federal government in the American Rescue Plan. The state got about 178 million this year and next year. The county, the county got about 178 million. The state probably got billions. How about instead of, he's spending a lot of money fixing up our parks, which I love parks, but we got to have our priorities. How about spend a good chunk of that money to relieve our poor hospital workers of the problems that they're having with capacity? We've got stories of people waiting for 10 hours in an emergency room. People aren't able to get elective surgeries. And has government prepared for that? Are they even aware of it? They must be aware of it. So I looked at the entire state of New York, and at the beginning of 2021, there were 45,000 inpatient beds. Now there's 40,000, 5,000 less. It's over 10% drop in a year. In a pandemic, I mean, to me, that's a catastrophe waiting to happen. And it shows how sensitive, I mean, our hospitals are running so close to the edge that even adding 100 patients or 300 patients in a system that has 2,000 beds is enough to drive them into crisis. And this is not the proper, the proper response of government is to foresee this stuff, not, just act like, oh my God, what happened? And these are, building up capacity in hospitals is not a quick thing you can do.
It almost seems to somebody outside of government looking in that everybody got married to a couple of theories in March and April of last year. And no matter what evidence comes out, they're just going to stay with what they believe, they want to believe works. Now, as far as masks go, a peer-reviewed study right on the CDC website came out. I remember this in May of 2020 because I was doing some paid independent research that concluded from every pandemic in the 20th century, they looked at them all, that no non-pharmaceutical interventions made a difference, including masks. And they dealt with the whole objection, well, why do surgeons wear masks? And they had a section in their study about that. Now, this was for influenza. But since that study, we have a year and a half of evidence, and I've seen much smarter people than I put out papers showing in this state, side-by-side counties, one had a mask mandate, one didn't. And you can't tell which one is which if you take the names away. So it just doesn't seem that the masks are working, at least not mandating them for the general population, whether they have symptoms or not, or whether there's any reason to believe they have the virus or not. Where do you stand on that? Do you think that they're just married to this idea and they're just not going to let it go? Or is there something we out here don't know?
Yeah, I don't know. I agree. You can find all sorts of studies, and but I mean, science is the process of trying to lift the veils from our eyes, and it's gradual, and they do their best. But there's a lot of things that cause just the ordinary person to look at and go, huh, like there are countries in Europe that have a higher vaccination rate and more mandates and are also experiencing spikes. There are states in the United States that have lower vaccination rates, no mandates, and are not experiencing spikes right now. Maybe they had them earlier. I get it. Everybody maybe experiences them at different times. But it's pretty clear that there's no silver bullets. I mean, I sympathize with the county and with the state because everybody thought that vaccines were going to end it, right? Vaccine comes out, a couple months later, we're done. Phew, look, it's all in our rear view mirror. And unfortunately, it hasn't happened that way because they're not 100% effective. They wane in effectiveness, and we have variants. So that's why I'm saying government has to decide, look, we got to be in this for the long haul. And hospitals are a big part of it because we have to run the hospital with the regular parents, but we have to also be patients, but we also have to be able to take the occasional surge in COVID. But I think the hospitalization rate is lower now than it was earlier. The death rate is lower earlier. So we are making headway. And so my main objection was the mandates themselves. So what have you done before you mandate anybody to do anything? Have you done everything possible to fix it? So since he was blaming the hospital capacity on the mandates on the hospital capacity, the logical question is, what have you done everything you possibly could to maintain or even improve hospital capacity? And it's with the information coming out of them, it's hard to say that they have done that.
The "we will not comply" that headline came off the WKBW website.
And I have, people call me up and say, hey, on WBEN, they just said this. So I call them up and said, did you guys say that? If you did say it, would you please don't, we are not, the way I look at it, and the Erie County legislature, the minority caucus, which is, I think, 3 Republicans and a conservative, they sent a letter to the state legislature basically admitting that his mandates are legal, but objecting to the fact that he's still got emergency powers after almost 2 years, and that this is happening, and they were appealing to the legislature to remove his powers, which they probably will not, but they're legal. So they're legal under a law that was passed by a legislature, signed by the governor, all per the Constitution of the state. Therefore, it's legal. I'm a public officer who is sworn to, protect the Constitution of New York. So that's what I'm going to do, even if I don't like it. I don't think public officers should get to decide what laws they feel like enforcing and what laws they don't feel like enforcing. I would be perfectly happy to hear a court tell me that, okay, you don't have to anymore because we think this is not constitutional or it's illegal. And we've already had some federal courts that have stayed orders from the federal government. And the other thing that we don't mention is that, or I haven't mentioned yet, is that they have fired or are in the process of firing a lot of hospital workers because they won't be vaccinated. So they're hurting capacity. I know a lot of people. I've talked to a lot of people since I came out with that statement. Many are for, many are against. Some people are rabidly against my position, and they think that at least 2 women told me that people who are not vaccinated should not be entitled to hospital care. That if they show up at a hospital and they haven't been vaccinated, they should be left outside in a tent and and then just die, I guess. So there are crazy people on both sides. So we try to maintain some level of reasonableness.
Well, believe it or not, my audience would be very aware of Supreme Court cases when it comes to the federal government and the states, where they've ruled that if there's a federal law that has either been challenged and found to be constitutional, or just hasn't been challenged and is assumed to be constitutional, that a state that objects to it doesn't have to expend its resources to enforce that law. If the federal agents want to come in and enforce it, then okay, we'll have to comply with that, but we're not going to spend our money enforcing this thing that we don't agree with. And that could be a liberal state not liking the immigration laws, or that could be a conservative state not liking the gun laws. Is there any such provision for a town supervisor as opposed, in relation to the state or to the county, or a county executive in relation to the state? Or is that not the case with inside a state, which is more considered more to be sovereign?
I'd have to take a pass on that. I don't know. I don't, like I said, our police department is fully occupied doing what it is that they do day to day. So we just have to leave it at that. We do have a requirement. If you want to come in a town building, we request that you wear a mask. But we're not going to get in a knockdown, drag out fight if someone refuses. If they're in a government building and they want to take care of business, they just and they refuse, just fine, come in, do your business, and then please go. But we had a town board meeting on Monday, and we wore a mask, the audience wore a mask, and if people need a medical I forget what they call it, accommodation, that if you can't wear it, you can't wear it. We're not going to argue with you. If you can wear, if you've got a shield you'd rather wear, please do that, or something, or whatever. I mean, there are, if you can't wear a mask, you can't wear a mask. We're not going to force you.
It's that time of the year again when we're all looking for something special to give friends and loved ones for the holidays. Unfortunately, the government and its bank have worked especially hard this year at doing what they do best: make things more expensive for the rest of us. Well, I have great news. You can get a free copy of my new ebook, An AntiState Christmas. That's my gift to you in appreciation for listening. But that's not all. I've also made the book available as a paperback at an incredibly low price, so you can get a few copies to give as gifts. It makes a great stocking stuffer. And don't worry, this is not some preachy libertarian treatise. It's full of fun and even includes a special Christmas beverage recipe. Get more information and your free ebook at AntiStateChristmas.com. We help each other when we don't mean to. That's what we call the invisible hand. Something no politician understands. Just leave it up to supply and demand and follow the goal. And I just want to say for the record too, and I think sometimes, especially with the media, the third option doesn't seem to be considered, which is, okay, if you're not prohibiting, or I should say, if you're not requiring people to wear a mask, that doesn't mean you're prohibiting, let's say, a privately owned business from requiring masks. They can require masks. They can require me to wear a blue shirt if they want to, right? So, there's nothing about this that says that, I as an individual couldn't call the store I'm going to and say, hey, you're going to be letting unmasked people in there, and if you are, I might not come. So just because it's not mandated doesn't mean it's prohibited, I guess, is where I'm going.
Right. And in my statement, I used the word counterproductive for the mandates. Well, what do you mean it's counterproductive? What are you, a doctor? No, I'm not a doctor. And it really, not so much the masks, but the next step, the vaccine mandate. That, I think, is counterproductive, because everybody's pretty much made up their mind about the vaccines. So your main effect is going to be, all the people that don't want to are just going to dig in even deeper, and they're going to just hate even more, and for actually pretty good reason. This government is treating us like children. They're not really telling us what they're doing, why they're doing things. It's just, no, we're going to have a mandate, and there's too many beds. Don't think, or there's too few beds. Don't ask why there's too few beds. because that might make us look bad. And therefore, if you do ask the question, then, oh, well, it's political. Well, let's face it, everything that comes out of a politician's mouth could be claimed to be political. Their accusation of me being political is political. And that's what they do. That's what people do to discredit the opposition, is to say, don't even, it's political, therefore you don't even have to consider the argument. That you can forget the fact that the federal government, your own hospital reporting shows you've got 10% fewer beds, which any person who's a citizen should be, in the middle of a pandemic, should be kind of concerned about. So going back to this counterproductivity argument, what you're mainly going to do is you're going to make everybody dig in even more. And that is counterproductive. I mean, in West Seneca, about 80% of the people, according to the county, are already vaccinated. And then you figure, how many of the rest of them have had COVID, therefore have at least some level of immunity. And then you've got a certain percentage of people that medically can't do it, can't for whatever reason get the vaccine. So if you throw all that together, what do you reach? We don't know, but is it 90%? Is it 95%? I mean, we're at 80% vaccinated already. And then and the county is like, that's of adults, by the way. In the county, it's like 77% of adults, and then the children are getting it and things like that. And then and someone said, plus someone said to me, plus the other mandates, that impact businesses, then you start an additional epidemic of business failures. So, and then education, what's happening to our children? I mean, it's a tough situation to be in government, certainly in a government that has control over medical facilities like the county and the state. I get it, but no one forced us to run, and no one is forcing us to serve.
The other thing about this since the beginning that has baffled me is that nobody has uttered a word about the cost of any of these policies. Now, the mask mandate probably wouldn't have as much cost to it as a lockdown, but there is a cost, especially for children. And I know that the school districts are not under your jurisdiction, but let's just say even for adults, I mean, walking around and not seeing each other's faces for years on end has some kind of social cost. And do you get any information as an elected official about any of the, let's say, non-COVID health effects of lockdowns or masks? How many deaths did we cause from drug overdoses or suicides or whatever? How many excess deaths were there, as a cost of doing this? It just never seems to even be a consideration.
No, you're right. I don't know the numbers. I think I've read articles that say things like suicides and drug overdoses are up, murders are up, at least in some cities. I know that our school district has hired additional psychologists and social workers to deal with some of the effects of this. Kids who are excessively truant, or it's a tragedy what's happened to our kids. So yes, there are significant costs that cannot be measured as easily as the number of people who got sick.
Yes, certainly. And I'm a psychologist, or psychiatrist, but I can't believe that, let's just say, a kid that's now just turning 7 years old, who might have been 5 when this started. I mean, this is like a third of that kid's life. They've walked around in a mask. There's got to be a cost to that. And it's, I guess what frustrates me is nobody acknowledges it. And everybody acts like there's no trade-offs here. And especially when you start talking lockdown, I think there's a huge cost. Now, if a public official came out and said, look, this is going to cost some lives, but it's going to cost more if we don't do it. I don't happen to agree that the lockdowns actually did anything, but at least that would be acknowledging it. And, the media doesn't seem to be interested in asking questions like that. Do you feel that they've been honest with us?
I don't know. I think that that's the short answer is I don't know. I think the media has suffered a lot, in the last 20, 30 years from, loss of revenue. So they're not as good as they used to be. the rise of, have to do clickbait, headlines. But yeah, they don't seem to be, when we were kids, they were more curious or more independent and asked questions of power. I mean, that's their job, is to question power and not simply regurgitate, what's in a press release, or not advocate, not think you're on the same team because you have to be supporting X policy regardless of the party. So
I guess that's where I was going with that question, is that I watch a telecast or a webcast of pulling cars up speaking, and then I hear the questions and I think, well, they seem to think their job now is to just write down what he said and tell us. In the 21st century, I don't need you to do that. I can watch it myself on my phone, right? So I need you to challenge him. Even if you probably agree with what he's saying, at least challenge it, vet these policies. That's how you serve the public, to make sure that the policies get vetted by somebody and the tough questions get asked. And maybe the answers will be good, but to just kind of repeat them. I don't know the difference between propaganda. I know that sounds like hyperbole, but when you're just repeating what government officials are saying as if it's the unquestionable truth, I don't think you're doing much service to the public.
Another thing about the mandates that I kind of find objectionable, or at least the arguments for them, is that if you don't share their opinion, then you're stupid. If you're a young woman who doesn't want to get vaccinated because she has a fear that it might impact her fertility, she is not stupid. She is thinking about her own health, and she's concerned. And just because her estimate of the risk is different than yours, mine, because me, a 63-year-old guy, is going to think, so what if it's a 1 in 1,000 or 1 in 10,000 chance that it could impact her fertility? Well, but for the person who's actually impacted, to her, it might be a huge deal. And yet we, or the people that are who are for the vaccines, think she's stupid, or she's a typhoid Mary, she's going to spread disease throughout the whole country. Or no, she's got perfectly legitimate reasons that we have to respect. I think I don't think all mandates are bad. I think there are circumstances where they're necessary. I mean, if this disease was like in the early 1900s, was smallpox or something, but this disease has a mortality for sure, but it's like 1% mortality.
No, it depends a lot on the age group as well.
Right. And if you count long COVID, let's say, just throw in another 9%, whatever. So 90% of the people recover fully. Individuals have to make those kind of they have to think about those things, so that when they make the decision. I guess there are some people that say the vaccines there's more injury from the vaccines than is being published. I have absolutely no idea about that, but you can find stuff like that out there.
Well, certainly there's more reported on the VAERS system, and that's self-reporting. So you can kind of say, well, we don't know for sure if these self-reporting people are right. But after a while, when it's many, many times what all the other vaccines combined have ever had reported, then, you have to say, well, there's got to be something there. And getting back to your example with the woman, yeah, I mean, when are we going to see some humility from these public health officials? There's been a lot of things that were absolutely true 10 months ago that they're now reversed themselves on. So, okay, I'm not asking for anyone to be perfect, but my gosh, learn from your mistakes and let's not make another one. We don't know what we're going to find out in 5 years. Maybe it won't have any effect on fertility, but if we find out that it did, and we not only suggested, but demanded that person take that vaccine, and then she's got a problem that can't be reversed, who's going to be responsible. So yeah, a little humility, a little inquisitiveness from the press would go a long way. I don't want to keep you all day here, but I wanted to ask you one more question. Based on the position you've taken, which, is a lot more nuanced than is being reported, what consequences, if any, do you anticipate going forward?
Well, there's really, an elected official, there's not, the only real consequence is usually the next election. And I'm, I am not committed to running again for anything. So we'll just wait. The reason I became supervisor was because I saw we had a need for good government in town, and tax tax control, control over our finances, which had gone up 20% in about 5 years, and open and transparent government. So if I can achieve that in 4 years, then maybe that's it. But that is the what else? I mean, theoretically, a court or the legislature could remove you from office, but other than that, I mean, people can yell at you. That's online and not.
And that's part of the job, no matter what you do, right?
Yeah, I actually had to. I got smart and I just turned off the comments on all my posts on my West Seneca Gary Dickson Facebook page, because people were just using it to argue with each other. Often, it's like, okay, if I turn off all the comments, then that's okay. The ACLU says that's okay because I can't discriminate. So if I just don't allow any comments, it's okay.
A wise move. I wish we could all do that sometimes, or be smart enough to do that. Well, Gary, I really appreciate your time. I wish you the best of luck with the rest of your term, and we'll keep tabs and see what's going on as we move forward into year 2 of the new normal. Thanks very much.
Thanks, Tom.
Okay, friends, that's going to do it for today. Don't forget to get a free copy of my new ebook, An AntiState Christmas, at AntiStateChristmas.com. Of course, if you haven't already, subscribe to this podcast on Apple Podcasts, Stitcher, or wherever you normally listen. And please do go to the Tom Mullen Talks Freedom website at TomMullenTalksFreedom.com and leave a review. And if you like the music you've heard on Tom Mullen Talks Freedom, you can hear more at TomMullenSings.com. Thanks for listening.
The war of ideas has only just begun. Arm yourself with the knowledge you need by heading to TomMullenTalksFreedom.com and subscribing to our email list. And remember, every revolution starts in the minds of the people.